Question 21. A patient must receive 50 units of humulin regular insulin. The label reads 100 units equal 1 millimeters. How many milliliters should the nurse administer? A. Half millimeters. B. 0.75 millimeters. C. 1 millimeters. D. 2 millimeters. Answer A. Half millimeter. Question 22. How should the nurse prepare an injection for a patient who takes both regular and NPH insulin? A. Draw up the NPH insulin, then the regular insulin in the same syringe. B. Draw up the regular insulin, then the NPH insulin in the same syringe. C. Use two separate syringes. D. Check with the physician. Answer B. Explanation. Drugs that are compatible may be mixed together in one syringe. In the case of insulin, the shorter-acting clear insulin should be drawn up before the longer-acting cloudy insulin to ensure accurate measurements. Question 23. A patient has just received 30 milligrams of codeine by mouth for pain. 5 minutes later, he vomits. What should the nurse do first? A. Call the physician. B. Remedicate the patient. C. Observe the emesis. D. Explain to the patient that she can do nothing to help him. Answer C. Explanation. After patient has vomited, the nurse must inspect the emesis to document color, consistency, and amount. In this situation, the patient recently ingested medication, so the nurse needs to take the remnants of the medication. To help determine whether the patient retained enough of it to be effective, the nurse must then notify the physician, who will decide whether to repeat the dose or prescribe an antiemetic. Question 24. A patient is characterized with a 16 indwelling urinary Foley catheter to determine if A. Trauma has occurred. B. His 24-hour output is adequate. C. He has a urinary tract infection. D. Residual urine remains in the bladder after voiding. Answer B. Explanation. A 24-hour urine output of less than 500 millimeters in an adult is considered inadequate and may indicate kidney failure. This must be corrected while the patient is in the acute state so that appropriate fluids, electrolytes, and medications can be administered and excreted. Indwelling catheterization is not needed to diagnose trauma, urinary tract infection, or residual urine. Question 25. A staff nurse who is promoted to assistant nurse manager may feel uncomfortable initially when supervising her former peers. She can best decrease this discomfort by A. Writing down all assignments, B. Making changes after evaluating the situation and having discussions with the staff, C. Telling the staff nurses that she is making changes to benefit their performance, D. Evaluating the clinical performance of each staff nurse in a private conference. Answer B. Explanation. A new assistant nurse manager should not make changes until she has had a chance to evaluate staff members, patients, and physicians. Changes must be planned thoroughly and should be based on a need to improve conditions, not just for the sake of change. Written assignments allow all staff members to know their own and others' responsibilities and served as a checklist for the manager, enabling her to gauge whether the unit is being run effectively and whether patients are receiving appropriate care. Telling the staff nurses that she's making changes to benefit their performance should occur only after the nurse has made a thorough evaluation. Evaluations are usually done on a yearly basis as needed. Question 26. Nurse Clarissa is teaching a patient about a newly prescribed drug. What could cause a geriatric patient to have difficulty retaining knowledge about prescribed medications? A. Decreased plasma drug levels. B. Sensory deficits. C. Lack of his family support. D. History of Tourette syndrome. Answer B. Explanation. Sensory deficits could cause a geriatric patient to have difficulty retaining knowledge about prescribed medications. Decreased plasma drug levels do not alter the patient's knowledge about the drug. A lack of family support may affect compliance, not knowledge retention. Tourette syndrome is unrelated to knowledge retention. Question 27. When examining a patient with abdominal pain, the nurse in charge should assess A. Any quadrant first. B. The symptomatic quadrant first. C. The symptomatic quadrant last. D. The symptomatic quadrant either second or third. Answer C. Explanation. The nurse should systematically assess all areas of the abdomen if time and the patient's condition permit, concluding with the symptomatic area. Otherwise, the nurse may elicit pain in the symptomatic area, causing the muscles in other areas to tighten. This would interfere with further assessment. Question 28. The nurse is assessing a post-operative adult patient. Which of the following should the nurse document as subjective data? A. Vital signs. B. Laboratory test results. C. Patient description of pain. D. Electrocardiographic ECG waveforms. Answer C. Explanation. Subjective data come directly from the patient and usually are recorded as direct quotations that reflect the patient's opinions or feelings about a situation. Vital signs, laboratory test results, and ECG waveforms are examples of objective data. Question 29. A male patient has a soft wrist safety device. Which assessment finding should the nurse consider abnormal? A. A palpable radial pulse. B. A palpable ulnar pulse. C. Cold, pale fingers. D. Pink nail beds. Answer C. Explanation. A safety device on the wrist may impair circulation and restrict blood supply to body tissues. Therefore, the nurse should assess the patient for signs of impaired circulation, such as cold, pale fingers. A palpable radial or lunar pulse and pink nail beds are normal findings. Question 30. Which of the following planes divides the body longitudinally into anterior and posterior regions? A. Frontal plane. B. Sagittal plane. C. Mid-sagittal plane. D. Transverse plane. Answer A. Explanation. Frontal or coronal plane runs longitudinally at a right angle to a sagittal plane dividing the body in anterior and posterior regions. A sagittal plane runs longitudinally, dividing the body into right and left regions. If exactly midline, it is called a mid-sagittal plane. A transverse plane runs horizontally at a right angle to the vertical axis, dividing the structure into superior and inferior regions. Thank you for watching.